Burke joining us now here, allergy expert Dr. Talal Nsouli. Welcome back. It is great to see you. Thank you for inviting very much for your time. It's always good having you here.
Exactly. So we have been really now seeing a great deal of patients with severe symptoms. We are at the peak of the allergy season for the trees, and we have been noticing patients having itchy eyes, watery eyes, and I think it's important to really imagine how these patients feel. And I would like to show in here a picture on how these patients, they get the itchy eyes, the watery eyes, stuffy nose, runny nose, they're rubbing their eyes all the time. It affects the quality of life. And this is the outer aspect of allergies. I think there's an important aspect that has been neglected, that allergies do not only cause the nasal component. The nose is a target. And it's not only the nose that suffers, but the whole well-being of the patient is affected. These are studies that showed clearly that it can affect the quality of sleep, it can affect the energy as well, it can affect the functioning, productivity at work. All these could be quite serious. So allergic rhinitis or hay fever does not only affect the nose, but affects the whole well-being of the patient and cause significant problems at work, including absenteeism. So, and it's important for the viewers to know that. Why? Because we have excellent treatment. It's important to know that often patients say, I have a stuffy nose, it's not a big deal, I'm going to rinse with some saline or take a little tea or anything of that nature. But we do have very good medications that one can use. We should find out, I think the first treatment of allergies is finding out what we are allergic to. Why? Because the best treatment, the first step in the treatment is avoiding the offending allergen. And that's why I think patients or people suffering from allergies should check with their physician and be evaluated, have an allergy evaluation to detect the culprit and to know how to avoid it. Why it's important? Because studies show that complications can occur due to chronic nasal congestion. So when we are congested all the time, we can have complications. We can have a recurrent sinus infection, and we know that sinus infections could be quite serious. This is the normal nasal cavity on the right side.
So you get the sort of infection you might get in the winter from an allergy?
The allergies, what happens, on the right side, we see how the sinuses circulates the mucus in a normal manner. On the left side, we see how the fluid will build up in the sinuses, number one, and number two, we have blockage of the window of the sinuses. This will accumulate and cause sinus infection. Other complications that can occur, recurrent ear infections. We can have also chronic cough. So patients that have chronic cough could be an allergic cough. We call it cough variant allergy. And then if they don't treat themselves, it might progress to asthma. So it's important to know that it's not only affecting the nose, but we have other things that we should look into it. Allergies. Asthma is an allergic disease of the lungs. That asthma usually a result of these allergens that we inhale through the nose. They get to the air tubes, the bronchial airways, and cause constriction, cause swelling of the lining, and cause mucus. And this result in wheezing, cough, difficulty breathing. Even we have death that this can lead to. We know that we have 4,000 people per year that do die from bronchial asthma. Totally unnecessary, since we have outstanding therapeutical agents and excellent protocol by the NIH that have been delivered. So again, starting early the treatment.
Let's go to the phones. Deborah in Woodbridge joins us first. Deborah, you're on the air. You're on line one. Go right ahead, please. You're on with Dr. Nsouli.
Yes. For the last couple of nights, my throat has been swelling, and it wakes me up coughing, and I have a very bad headache. I was just wondering what's good for that.
I'm curious, window open, window closed for you?
Window closed.
All right, doctor?
Yeah, Deborah, I think that's a good point in here. Certainly patients that do get nasal allergy, get hay fever, they do also experience post-nasal dripping that can cause some irritation, and this can also cause cough. So it's important to know if this is happening only due to this season that started about 3 to 4 days ago. Could be only an allergic reaction, hay fever going on, treating with a nasal topical steroid or an antihistamine will be certainly helpful. If this continues, then one has to look at the sinuses, be sure there's no sinus infection going on.
We have about 45 seconds left. How long has this been going on, Deborah?
It's been going on for the last 2 days. I've been out of work for the last 2 days.
So most likely this is coinciding with the high pollen count, and I think using the antihistamines, we have excellent ones over the counter now, and the nasal sprays, the nasal topical corticosteroids that are very effective that could be used, and this will certainly help Deborah resolve her problem.
Continuing our conversation now here on News Talk with allergist Dr. Talal Nsouli. We're going to go back to the phones in a moment. I asked Patty in Woodbridge to stay on the line. You're on line 2. We're going to take your call in a moment. So you are next. We'll try to get in a couple of calls if we can. The number here, 703-387-1020, as we continue to talk about what has turned into a very miserable allergy season here in the Washington area. How do we, there's so many products on the shelf that claim to offer relief, and you were talking about this at the end of the previous segment.
Correct.
How do you choose?
We have a variety of medications that are certainly on the shelf. I personally prefer the patients to come and to see us to get the medication from our clinic. However, they have access to very good medications. It depends exactly if we have some mild allergies, if we have some severe allergies, but there are several of them that are on the shelf, such as Allegra, that has been now approved on the shelves for about the last 2 or 3 weeks. It's a non-sedating antihistamine. I think it's important for the viewers to know to use a non-sedating anti-allergy medication that does not get to the brain, does not cause any functional problem. And we do have the Claritin that's over the counter. We do have also the Allegra now is over the counter as well. Zyrtec to a certain extent, but to stay away from the ones that are sedating that can cause some type of somnolence. These are some of them. In terms of nasal sprays, we have very little nasal sprays that are effective. We have the nasal sprays that are saline nasal sprays that could only wash temporarily a little bit the pollen. But it's important to know that nasal saline does not replace the anti-inflammatory steroids that we prescribe that treat the phenomenon and treat the disease. So I think that's important to keep in mind.
Back to the phones. Patty, as promised, you're next. Go right ahead with your question, please.
Yes, hi, good morning. I wanted to ask, my sons, they have been taking some medicine for allergies, but they have been bleeding a lot from the nose, and I would like to know how can I help them because they have been constantly bleeding. And I know I took them to the doctor. They gave me a treatment for albuterol for one of them, but I don't know if that will produce or cause more of the bleeding.
Patty, I have a question for you. You all have been using any nasal sprays or no nasal sprays?
No, the treatment, the albuterol treatment is on mask.
Only the albuterol, but no nasal sprays that are used in the nose?
No, I haven't used the spray on the nose yet.
Okay, so nasal bleeding, this is certainly an important topic that can, we see it in patients with allergies and can result from several things. This can result from the allergic component, so when we have inflammation in the lining of the nose, then we do have some type of bleeding that can occur. Number 2, if we have itchy nose, often we have tendency to rub our nose and this can stimulate bleeding as well. If there is some crusting in the nose, this can be another reason why we can have some bleeding, or if we have a possible sinusitis as well. Often we see patients with allergy symptoms that are using nasal sprays. And I brought in here a tiny model to show you what happens when this is used. So this is a model of the sinuses and the nose, and this is the septum. And this is the septum that it's very rich in blood vessels. So whenever we spray something close to the septum, then we start to have some type of problems related to that. So we did a study that we conducted 2 years ago with our team, and we showed using the nasal spray in the outward position, this is the right way of doing it, and not to use it inward.
Interesting.
And this is why you see in here, I'm going to see the light. This is the wrong way. You see the red light and the green light on this side, and this is the correct. So outward is correct. Inward is the wrong one. So very important to remember always to spray away from the septum to avoid the bleeding. And we see it in patients that are using nasal topical steroids, and often these patients do discontinue using them because of that. But if you use them with the right technique, the bleeding will go away.
I don't know if you can answer a question in 45 seconds. That's all I have.
Sure.
Rita wants to know about her husband who has allergies all year long.
Allergies all year long are caused by something that we are exposed to the whole year round, and this is dust mite mainly. If we have pets at home, cat and dog dander can cause that, and this is what we call the perennial allergic rhinitis. And these patients usually get really affected because they don't get a break. Therefore, they have to be really evaluated to find out exactly the nature of their allergy, the severity of their allergy, and to be treated. we have
evaluated by an expert.
Evaluated by an allergist immunologist. It's very important to really explain that nowadays we have outstanding treatments. No one should be suffering from allergies. No one should be suffering from asthma. With the outstanding treatment, outstanding protocols and guidelines, we can be asthma-free and allergy-free.
We hope you will come back and share your expertise with us again very soon. Dr. Talal Nsouli,
Thank you for inviting me.
Thank you for your time.